Hello, everybody. I'm just going to bring up a deck which I'll be using. So my name is Jez, and I am responsible for growing SISU. We focus on growing the business in a number of different key areas. So we do work with employers, but of course we work with local authorities and directly with the NHS in different settings as well. Um, the key sort of focus for CISA in terms of the problem that we're looking to address, and obviously supporting Southwark and some of the challenges that they're looking to work on as well, is really focusing very much around getting people to do health checks, and particularly people where there are inequalities and different challenges with addressing health. And we have a real focus around CBD. And as we know, that's a key focus for the Labour government. They're looking to reduce deaths from CBD by around 25% over the next 10 years. We're looking to have an impact in several different areas, and our feeling is if we can drive a greater empowerment around preventative health and giving people greater access to health checks as a core part of our proposition, we can address the four core areas around saving lives as per the government target, reducing inequalities, delivering an economic benefit, and of course increasing NHS capacity. And we're looking to do that through what we believe to be a relatively straightforward model, but as always, there's lots of different sort of complications with which we look, or different ways in which we can sort of deliver the proposition. So first and foremost, for us, it's around getting people to opportunistically do health checks. We can be very targeted as well, and there's a number of different programs of work that we're looking at the moment. But there's a real opportunity to get people to do health checks, particularly in places where they live their lives. So, for instance, with Southwark, we have health stations in a range of different locations, such as libraries and community centres. But at a wider level, nationally, we're in workplaces, pharmacies, community centres, pretty much anywhere where the general public goes. The proposition and the platform itself, and particularly what we have in place within the Southwark area, is comprised of our Max Health Station, which is this larger unit here. We have that, which then connects to our online portal and our app. And then we have some other aspects of our platform, which I'll come on to shortly. But in its rawest terms, a person may see a health station in the community centre. They'll go over to it. It's a Class 2A medical device. So from an information governance perspective, it's in a good place. When a person goes onto the health station, the first thing they'll be asked was their consent to share their data with SISU, so we'll be able to hold that. They own their own data. And then we'll also ask for an email address, which starts an account creation process. First part of the health check is to do their height and their weight. There's a height sensor at the very top here and a set of scales, and that gives them their BMI score with a recommendation as well. And we follow nice guidance with the recommendations and also take guidance, and Alice will talk shortly about some of those suggestions that Southwark are coming through with their evaluation as well. So we do height and weight of the BMI. The next stage is that they do their blood pressure. So you can see there's a blood pressure cuff here, and it's a seated position, really, really important from an accuracy perspective. So they do the blood pressure check. They'll also get a recommendation. They'll also get a heart rate score. And then they'll also ask a number of different questions. So we ask a range of different demographic questions, which feeds into some of the risk assessments that we do. Following that, they'll then do body fat, which is just two metal handles here and here, which send an electrical impedance signal around the body, and we surface some information about that. And there's a range of customizable surveys that we can deliver as well, such as Q-risk or DITC for alcohol. There's a stress survey, and of course we can build surveys to order as well. And there's a number of different screens which will appear. And a great part about the platform and the work that we've done with Alice and the team is around surfacing screens based on different risks that are identified. So there'll be screens which will appear based on whether people have certain risks around blood pressure or smoking, which will direct people and provide pathways. And indeed, some of the work we're doing with other partners, such as Southwark Council, we have another piece of software which we call our practitioner portal, which in essence, a health practitioner can then access and consult with that particular individual and then triage them onto onward services. And that's a really important part of the platform, is that we're looking for lots of opportunities in which we can provide a pathway and direct people to locally available services and try and triage people to the right place. All of that process feeds data into a platform. We're able to provide you with analytics around usage, demographics, health improvement, and Alice will talk about some of that as well. And the other aspect of all of our platform is that individuals are able to access their data via our app. There is a real key focus on the empowerment and giving people an opportunity to improve their health. And indeed, we see from survey data that a large proportion of people do look to make and modify their behaviours, and a great proportion will use the app as a mechanism to do that. Since 2021, when we launched our proposition with Southwark and a couple of other partners as well, things have been scaling quite rapidly. In 2022, we were featured on the BBC Evening News for our work with Luton Council, sort of post-COVID and their vaccination centres, and trying to opportunistically capture health checks. We joined the Digital Health London Accelerator programme that year, which has really helped us develop our proposition. And then last year, we launched our multi-language platform in the EU. And Sam, who will come on to talk a little bit later, will talk about the development for that in a public setting. We also launched our mini health station, which was on the previous slide, and that's starting to gain further traction. And we put some bids in with a range of different clients. And one of the sort of key bids for us last year was a HTAP bid with Suffolk and North East Essex ICB, where we've rolled out 18 stations this year into a very wide range of different public settings. And to date, we've completed 1 million health checks within the UK, 5 million, well over 5 million internationally. We've launched into a range of different countries within the EU, which we'll talk about momentarily. We've had a pilot where we've transferred data directly to GP practices in the Luton area. And again, we'll be talking about the next steps there. And as of right now, we are now in around 50 different NHS locations, and that is growing very rapidly. And that is me done. So I will now hand over to Alice, who will talk about the evaluation within Southwark.
Thanks very much, Jez. I'll just bring up my presentation. Please let me know if you can't see the full slide deck. Great, thank you very much. So, hi everyone, thank you for coming along today. I'm Alice, I'm a Public Health Programme Manager at Southwark Council, and I'm really pleased to be able to speak to you about the findings from our evaluation of Southwark's Community Health Kiosk Programme. In terms of what I'm going to cover, I'll start off with a bit of context around Southwark as a local authority, our health kiosk programme and the approach that we took to our evaluation. And then in terms of the findings, unfortunately, I don't have time to go through all of the data related to every single outcome that we looked at. If you're interested in that, Jez will be sending around the full report after this, so please do take a look at that. But instead, I've just picked a few bits of key data that I think will be of interest to this audience, and I'll cover those under 3 subheadings of strengths of the programme, how we want to go about improving the programme as it currently stands, and then opportunities for further development and expansion. You might notice that there's no limitations section here. That's not because I don't think there's any limitations relating to the research that we've done. Rather, I'll just note some key limitations as we go along. But I think the main thing that I will say in relation to that is please bear in mind that this was an internally performed evaluation. We intended the evaluation simply to support our own commissioning decisions as Southwark Council Public Health Team. It wasn't designed to be an academically rigorous piece of work, and we didn't get any academic input on this. You might also notice when I bring up some of the quantitative data that it's lacking statistical analysis. That's simply because we didn't feel it was necessary for what we need these results for. However, I hope you'll agree that there's still some really great data in here and some really interesting learnings that I think will be very relevant to other local authority and NHS partners. So moving on to where we are in Southwark. So we're in Inner London Borough. To help you get your bearings, the Thames runs along our north border here. In the northwest, we've got landmarks that include Tate Modern, London Bridge and Tower Bridge. Central areas of the borough include Camberwell, Peckham and Old Kent Road, and the centre of Southwark is really characterised by its cultural and ethnic diversity, including large Black, African and Caribbean populations and quite a large Latin American population in the Elephant and Castle area. The centre of Southwark is also where we see our highest levels of deprivation and where the majority of our neighbourhoods that are in the 20% most deprived nationally are. As you head down south, we've got Dulwich, and Dulwich, generally speaking, is a more affluent area with lower levels of deprivation. Because of that geographic inequality in socioeconomic factors that I've alluded to, and the intersection that we know exists between socioeconomics and ethnicity, we do see pervasive geographic and ethnic health inequalities in Southwark, including, but not only, in the prevalence of long-term conditions and in life expectancy as well. So you can probably start to see why in Southwark we're really interested in exploring alternative mechanisms of health check delivery that can help us address some of these inequalities. But the Southwark Health kiosks weren't actually originally commissioned as an intervention in and of their own right in order to address some of these issues. They were actually originally commissioned in 2021 to sit alongside a wider piece of work, which was our pilot of an NHS digital health check in the borough. So we commissioned the kiosks in order to provide a physical station by which people could go and get their BMI and blood pressure checked that would then supplement the online form that they would conduct. Since then, the kiosks have sort of been co-opted to sit within a range of different public health programmes in Southwark. So in 2022, our local care partnership, Partnership Southwark, became very interested in the kiosks as a mechanism to support their Vital 5 programme, which was all about increasing residents' awareness of their Vital 5 measurements. And then in 2023, Southwark Council Public Health team ended up taking over the contract. And at that point, we decided to extend our contract with SISU until 2025, with the idea that that would give us time to do a proper evaluation of the kiosks as an intervention in their own right, and to consider whether the evidence was strong enough for us to consider expanding the programme further and putting further investment into this. The map on the right shows the current location of the kiosks. We have 4 in libraries and 2 in leisure centres. Moving on to evaluation. So as I've sort of said, we really wanted to use the evaluation as a sort of stock take, really. And the first aim was to develop a theory of change and to more clearly define our short, medium and long-term outcomes that we would be interested in the programme achieving, and identifying key performance indicators that we could measure into the future. We of course wanted to determine whether or not the programme is delivering on those intended short-term and medium-term outcomes, both generally for the whole Southwark population, but really specifically we're very interested in whether it's meeting those aims for our target groups. We also wanted to understand, if we were to continue with this programme, what service improvements or expansions we'd need to make in order to ensure that those outcomes are being delivered. And finally, the health kiosks in Southwark are of course not the only mechanism by which people can get a health check in the borough. We've also got our NHS health check programme, and in Southwark we also have a community outreach programme which delivers health checks within the community, face-to-face ones. So we wanted to ask, are the health kiosks providing unique benefits within this context, or are they duplicating efforts from other models of health check? So that brings us on to how we actually went about the evaluation. As I mentioned, we started with a theory of change. There's a lot of detail here that I don't have time to go into, but we essentially identified 16 short and medium term outcomes that we believe would be needed in order to allow the kiosks to achieve the long-term goals for the programme. So I won't go through the outcomes in detail, but we did use the COMBI model of behaviour change to define these outcomes. For those of you who might not be familiar with that model, it essentially says that the factors that you need in order to influence a behaviour change relate to a person's capability, opportunity and motivation. So our short-term outcomes relate to the capability, opportunity and motivation factors that determine whether or not a resident gets to a kiosk in the first place and then is able to use the kiosk. So that includes things like knowledge of where the kiosks are and the skills required to use the kiosk. Our medium-term outcomes related to the capability, opportunity and motivation factors that are then needed for someone who's used a kiosk to then take that knowledge and change it into sustained behaviour change following kiosk use. So that's where our 16 outcomes have come from. The only other thing that I wanted to flag on this theory of change is our target population groups. And when we were workshopping what our sort of target groups should be, we decided that we would settle on our core 20+5 groups. So people living in the 20% most deprived nationally, our residents of Black, Latin American and ethnic minority heritage. And then secondly, other target groups related to people who are either ineligible for or less likely to take up the NHS health check. And for us, this is men, and then the under 40s and people with existing long-term conditions. In terms of the methods that we took to actually measuring those outcomes, there were three main ones. So the first was that SISU sent out an online survey to anyone who'd used a Southwark kiosk since November 2022. We only received 48 responses to that. So I'll flag the first limitation here, which is for this approach, for this method, that is a relatively small number of people in comparison to all the people who've used the kiosks. The demographic profile of the people who responded to that survey was also slightly different to the demographics of our kiosk users in general. So women, white people and older people were overrepresented amongst the people who responded. And finally, around 60 to 70% of the people who responded to our survey were repeat users, which is more than the general cohort. So that indicates that people who are responding to this survey, we think were probably more on the positive end of the spectrum in terms of their general perspectives of kiosk use. Having mentioned those limitations, there's still some great information that came out of this survey. And it's important to mention that SISU are planning on now rolling out a lot of the questions that we ask through this survey on a regular basis to people who use the kiosks. So hopefully we'll get a lot more accurate and representative data moving forwards. In order to supplement that survey, we also did qualitative opportunistic surveys of library and leisure centre users and staff in those locations. And those were really great for understanding people's awareness of the service and understanding their motivations either for or against wanting to use the kiosks. And then finally, one of great benefits of the kiosk is that we get a wealth of information from the kiosks themselves regarding the demographics of the service users, their health measurements, importantly, how their health measurements change over time for any repeat users, and user satisfaction data as well. So moving on to the findings. So I'll start with some of the data that we think represents the strengths of our programme. There really has been considerable increases in the number of health checks being conducted every month over the course of the programme, culminating in an average of 62 checks per day being conducted in Southwark across our 6 health kiosks in May 2024, and that's only increasing month by month. So as commissioners, we really do believe that the kiosks are helping to bring health checks and improved health literacy to the population of Southwark. There's also really good uptake of the service amongst our target groups. So 51% of health checks conducted have been conducted by men. That's in comparison to 48% of NHS health checks. But it's important to bear in mind that with our NHS health checks, that's been achieved with a lot of targeted promotion towards men to try and get them to take up the offer. Whereas with the health kiosks, we've achieved that 51% entirely organically. 61% of our kiosk users are of Black, Asian or ethnic minority heritage, and that's in comparison to 45% of our general Southwark population. and 28% of users belong to the core 20 in comparison to 21% of our general population. You'll see on the graph on the right, the age profile is very much shifted towards those younger age groups. It's maybe not a surprise, but it's maybe also counterintuitive to think that sort of the under 40s are a target group for us, given that we know there's a lower prevalence of long-term conditions, and in terms of early detection, it's really important to reach those older age groups. However, in the context of all the health checks that are happening in Southwark, we're really pleased with this because we believe the kiosks are helping bringing increased health literacy and health checks to a population who aren't otherwise eligible for health checks and are less likely to be sort of regularly attending healthcare appointments as well. We also have generally positive feedback on the kiosks and their ease of use. 96% of the previous kiosk users we surveyed indicated that the stations were easy to use. I'll caveat that with just the limitation that I mentioned earlier about the fact that we think these people are more likely to be repeat users, probably have more positive sort of perceptions about the kiosks. However, we also have data from a much larger sample and more representative sample, because there's a question on the kiosks themselves that asks about users, how likely they are to recommend the service to others, and 71% of all kiosk users who answered that question in Southwark gave a rating of 9 or 10 on a 10-point scale in terms of how likely they would be to recommend the service. We've also got data from residents who haven't used a kiosk before, so our leisure centre and library users, and 52% of those people said that they would be interested in using a kiosk in the future. Finally, we've got a wealth of qualitative information from the evaluation. I really love some of these quotes. I think they really demonstrate the value that people place on the kiosks, whether it's about the fact that it's helped them to see that they need to go to a GP to get help for weight decrease. It's motivated them to live healthy lifestyles. We received a lot of comments about the accessibility of it. So, for example, here, much easier to step into than a GP or a chemist. And finally, I love this one on the right because I think it demonstrates the co-benefits of putting health checks within a community location. So this person was able to go to Canderwater Library to check how their training was going, but also get some new books as well. Moving on to the outcomes following kiosk use. When it comes to capability to make a healthy lifestyle change, we know that knowledge of health status is a really big facilitator. And 85% of the people we surveyed reported that the knowledge of their health status and measurements increased after using the kiosk. Data from the kiosks themselves shows that 71% of people who had their blood pressure checked had not checked their blood pressure in the previous 12 months, indicating that the knowledge gain that the kiosks are generating, but also that the kiosks are reaching a population that perhaps wouldn't otherwise be checking their key health measurements. And then finally, when it comes to the actions, 84% of those who had been recommended to make a specific lifestyle change indicated that they had taken action to improve their health since using a kiosk. And the graphs on the right demonstrate the different types of actions that people had taken. When it comes to actual health outcomes that haven't been self-reported, we know it can be really difficult for interventions like this to collect that longer-term data. However, this is one benefit of the kiosks because we can actually see that data in real time. And with the caveat that I can't tell you if any of these changes are statistically significant, we do have some data that suggests there are positive trends, particularly around people's blood pressure and smoking status. So around 19% of repeat users who initially recorded a high-risk blood pressure rating on their first visit to a kiosk have since recorded a blood pressure associated with a lower risk rating. And people aged 45 plus were more likely to register an improvement to their blood pressure. Then next, 9.3% of repeat users who indicated they smoke on their initial health check had since indicated that they stopped smoking. So I mentioned that we wanted to understand the unique benefits of the health kiosks in Southwark. So we did a bit of a comparative analysis looking at the kiosks against our community checks and our NHS health checks. And the report has a much larger table which details all the benefits and the challenges associated with each one. But in terms of the kiosks, the key headlines in terms of their unique benefits that we feel they bring are the suitability for those who prefer to check their health independently for whatever reason they might have of not wanting to visit a healthcare professional to get that done. The accessibility, the fact that no appointments needed, people can go at any time that the leisure centres and libraries are open at a time that suits them. They're really able to reach target groups without putting resource into targeted invitations or marketing. And they allow users to check their health regularly and track their measurements over time, which is really important in terms of generating that motivation for behaviour change. And then secondly, finally, in terms of the benefits to the commissioners ourselves, low cost per check, we've estimated that an average health kiosk check in Southwark is about 6% of one of our NHS health checks. And of course, the ease of data collection and service monitoring as well. The key message here is I'm not saying this to argue that the kiosks are better than NHS health checks. That's not the case, and NHS health checks have a lot of different benefits associated with them, which can be found within our table. However, I think the key thing here is to recognise is that each model of health check delivery brings something different. It has different benefits and it can reach different populations in the most effective ways. And so I think this really shows how we can consider our health check model as a whole and how we can target our resources most effectively. Moving on to data that represents some areas that we've identified could be improved when it comes to our programme. The first is around improving awareness. We didn't feel like it was necessary for this evaluation to do a population-wide survey of health kiosk awareness, but we used a few different readouts. So we looked at awareness amongst our leisure centre and library users, which averaged at about 44%. However, you can imagine that amongst the general population, it will be a lot lower than that. And we also looked at awareness of our leisure centre and library staff, frontline staff, and the likelihood of staff to promote the kiosks to residents. And it's that latter area where we think we could really make big improvements. Only 24% of leisure centre and library staff said they had ever actively promoted the health kiosk to a service user. And amongst the previous kiosk users that we surveyed, only 4% said they'd used the kiosk because they'd been recommended to by a health or care professional. So in terms of our recommendations, we want to improve awareness amongst the general population by focus on boosting awareness in our frontline staff, whether that's health and care professionals or whether it's housing, leisure or other staff in the borough. We really want to work with our leisure and library services, not only to build staff awareness, but really take it back to the fundamentals and think about how we can improve their understanding of their role in health promotion, with the hope that we'll then see outcomes when it comes to the health kiosks. The next challenge is around accessibility. We received a lot of comments through the evaluation about the fact that the kiosks aren't accessible to people who are digitally excluded or don't have an email address. This is a vitally important point, especially when it comes to addressing health inequalities, of course. However, what I think that comparison of the different models of health check showed was that every intervention doesn't have to suit every person in the population, as long as there is an option for everyone and as long as it's working effectively for those people. So, we would say that we don't think the problem is that you need an email address, and actually we think that removing the need for an email address would have a lot of unintended consequences on the population that is using the kiosks. However, if you take a look at this quote here, so one person had been referred to use the kiosks, but when they turned up, they hadn't realised that they needed an email address and then just sort of had to leave. this demonstrates that the problem is the fact that that person was referred to the kiosk service in the first place. We need to make sure that frontline staff in the borough know the different health checks are available and what type of health check is available to what types of populations. We need to ensure that people like this who maybe don't have an email address are never getting to the kiosks in the first place. They should be referred to our community outreach service, where you don't need any contact details to be able to attend that service. When it comes to accessibility, language is a big thing as well. Currently, we only have English available on our kiosks. Jez mentioned that they're developing multi-language platforms, and we will be working with SISU to make sure that we have language options on our kiosks that are most suitable to our local population. Bringing it back to the COM-B model again, and thinking about the importance of motivation for actually using a kiosk in the first place. One thing we identified as a barrier to motivation was people thinking that either they're not at risk, or because they already have the information that the kiosk is providing. So people would often quote the fact that they already know their BMI or they already know their blood pressure. In terms of the survey that we sent out to kiosk participants, one of the most sort of negatively answered questions was around, did you understand what the health kiosk was and the benefits of using it before you used it? And 29% of people said no, they didn't. So there's clearly something we've got to do here around communicating what are the different aspects of the check beyond just the BMI and the blood pressure, which are the obvious ones, and what are the benefits of the kiosks that have actually been described to us by users as well. We also want to consider alternative ways of motivating and incentivizing people to use the kiosks in the first place. In Southwark, we have something called the Better Points app, which provides financial incentives to people who make different healthy lifestyle decisions and changes. And so the health kiosks, using the health kiosks could be one of those. Next, I'm sure it's no surprise to anyone that we received a lot of concerns about data usage and sharing, and I would say that this is the biggest barrier to getting additional people involved in using the kiosks. It was by far the comment that came up most frequently, and people have real concerns over where their data's going. It was quite a big issue for people that it wasn't clear to them what the link was, for example, with NHS services, and whether it was an NHS service or not. So our recommendations here are around reviewing and improving statements about data usage and sharing. Firstly, on the kiosks themselves. Secondly, on any promotional materials, any materials we're sending out to health and care professionals. And thirdly, on any emails that get sent out to users of the kiosks as well. In the last 5 minutes, I'll talk about our plans for development and expansion of the programme. So we believe we have sufficient evidence, given everything that I presented to you today, that the Southwark kiosks are bringing benefits to our residents in terms of aiding the early detection of long-term conditions. And we believe that expanding that programme further will enable us to reach more people and enable us to bring more benefits to the population. In order to decide where those new kiosks should go, we looked at two things. Firstly, the geographical areas where they should be placed. So we did a geographical analysis of the populations of our target groups and the prevalence of long-term conditions. And that identified the areas shaded in purple here as places where we want to think about having new kiosks. And secondly, we identified types of locations that we want to put them in through a literature review and a survey of current users around their preferred locations, which is shown in the graph here. So in terms of types of venue, we're looking at placing new stationary kiosks in health centres and shopping centres. And we're also considering piloting a rotational approach whereby kiosks would move around different community centres and places of worship. In terms of some of the questions that we asked to our previous kiosk users, we asked them about how their knowledge of their own measurements changed following kiosk use, knowledge of the actions they should take, and knowledge of local services. And it was the question about local services that was answered sort of the most negatively. So we think there's probably something for us to do around optimizing the language that's used on the kiosk user journey in order to ensure that measurements and recommendations, and crucially those local services, are being communicated effectively. So we want to ensure our recommendations are not only aligned with local protocols and NHS guidance, but are really demonstrating the services that are most suitable to Southwark residents, but also non-residents as well who might be in the borough. Secondly, when it comes to how we might think about optimising our user journey and developing that further, we have a few concerns around BMI ratings and blood pressure ratings not being adjusted according to ethnicity in the case of BMI and age in the case of blood pressure. That currently doesn't happen automatically on the kiosks. In terms of BMI, it's provided as a sort of textual note saying that people of a certain ethnicity should adapt their rating in a certain way, rather than providing them with your BMI is low, normal, elevated or high according to what their ethnicity is. We're really keen to work with SISU to get this sorted in order to ensure that an equitable service is being delivered to everyone regardless of ethnicity and age. Next, and finally, is just about how we want to think about integrating health kiosks within our wider public health system. So we know that a key challenge for models of health check delivery is how to translate that improved knowledge about their measurements and their actions that they need to take into that sustained and effective healthy behaviour change. We think that an important way of doing this is that ensuring that the relevant people who want to be are being followed up with the relevant services. Only 8% of our service users that we surveyed reported that they had visited a local health or wellbeing service following kiosk use. So we want to continue working with SISU and with our primary care networks to develop a mechanism of linking health kiosks results with GP records. And secondly, Jez mentioned the possibility of developing practitioner portals, and we're really keen to do that to ensure we can facilitate direct referrals from the kiosks into our healthy weight and our stop smoking services. So that's the final bit of the results that I wanted to say. Just in terms of key messages, I would say the evaluation did meet all of its aims. It allowed us to identify key performance indicators, assess outcomes, and really understand the unique benefits of the health kiosks and the challenges that exist as well. It's really important to note there were limitations to our methods, but we're confident that as commissioners, they've given us the data and insights we need, and we really do hope that they'll have important lessons, sort of lessons learned that will be helpful to other NHS and local authority partners as well. If anyone was to ask me what I think the key strength of the kiosks are, I would say it's in their ability to reach target groups and target groups facing health inequalities, and that it's an alternative form of health check that is accessible, opportunistic and self-service. And then finally, in terms of our next steps, we do plan to recommission and expand our health kiosk programme, and our focuses for the future are increasing uptake amongst our target groups, encouraging and monitoring behaviour change following kiosk use, and integrating the kiosks within our wider public health system. And that's me finished. These are just the people that I'd like to acknowledge, my colleagues at Southwark Council Public Health Team, and Jez, Rob and Samantha, who are the people that we've worked most closely with at SISU. Thank you very much.
Thank you very much, Alice. That was very insightful. We do have a couple of questions that came through, but we'll tackle those at the end. So without further ado, I'm going to hand over to Sam. Sam, would you mind giving us a bit of an intro to yourself and what you'll be talking about today?
Yes, thanks, Tom. Hi, everyone. I'm Sam. I'm the CEO of SISU Health. I'm just going to take 3-4 minutes of your time to run through some sort of rounding out slides and information, and then we will go on to our Q&A. I'm just going to start by giving my own personal thanks to Alice as well in terms of the presentation today, which I'm sure you will all agree has been very, very detailed and has taken a considerable amount of time and effort from across the Southwark team and wider as well. So a big thank you to everybody, and particularly to Alice today for coming to present, which is never an easy thing to do. Just very quickly then, so just going to round out by sort of giving a few insights into what we're seeing in the broader sort of space, really sort of building on some of the points that Alice has made today. And I think everyone will agree that, really sort of key to particularly SISU's vision, but more widely as well, is we really want to be in a position where every individual has the tools and support to stay healthy, not just to address disease once they're unwell, but actually to stay healthy in the first place. And what we're very much seeing in this space is many different kind of aspects really gaining momentum. So as Alice mentioned, there's no one sort of suitable mechanism for everyone. Every individual is different. We're really seeing that momentum build across a range of sort of different collaborations and partnerships. So we've talked today very much about the localised prevention services that you might find in the local authority, how we're starting to see more and more of that connection to the NHS Health Check. We're starting to see a move towards the digital NHS Health Check, delivered not only through sort of primary care, but also within the community and through much more digital means as well. We're seeing much more movement from employers as well. So if you think about where we work, for example, with a large retailer who are offering self-service health checks, to those who are doing night shift, whereas you can appreciate someone on night shift, it's very challenging for them to access a GP or perhaps even to attend a more traditional face-to-face NHS health check. If you're looking at the likes of Jaguar Land Rover, for example, who are working with Solihull on the CVD workforce and who are very motivated to increase their impact, both on their employees, who perhaps are struggling to access health in other ways, but also across their communities, across their suppliers as well. And then you'll be very well aware of what's happening in the pharmacy space, where we're trying to drive far more sort of capability into the pharmacies to address prevention as well as to help people with treatments. But also we're looking to sort of join all of those things up across that space, also into primary and secondary care as well. Within the centre of that, really starting to leverage that sort of empowerment, but appreciating that people need support either with early prevention or perhaps with treatment and diagnosis as well. And I think the interconnected ecosystem is just so important in that space. From a SISU perspective, we're obviously trying to facilitate a digital first, but we also appreciate that that's not suitable for every member of the population. It is very data driven, and as Alice says, that has a huge range of benefits in terms of the insights and the data that we can provide both to individuals as well as to local authorities, NHS, etc. But that also comes with a range of very sort of well-considered risks and constraints that we have to manage very carefully as well. Just have the next slide, please, Jez. So just a little comment on the sort of building out of the ecosystem. I think the first thing that we're all trying to achieve is making sure that health is very, very accessible. So whether that is for the night shift worker at 1 a.m, whether that's for the person who's dropping their kids off at the leisure centre and able to use, for example, a health kiosk, or whether that's somebody accessing a localised prevention service or a primary care or even secondary care as well. So we're continuing to work with all of our partners, including Southwark, to sort of really build out that accessibility, both in terms of where access to the platform can be found, but also in terms of increasing accessibility of the platform itself. So as Alice mentioned, looking more and more at things like places of worship, supermarkets, places essentially where people go on a very regular basis, that is highly convenient and highly accessible for them to use. But also key to that is making it really personalised and engaging. I think a lot of the feedback that we get is that, healthcare and sort of motivation, it needs to be engaging, it needs to be relevant, it needs to be personalised. And those pathways need to be simple. So facilitating people to get the right access to the right pathways based on their particular circumstances, their particular conditions, and perhaps what they're eligible for as well. Next slide, please. So just quickly on a few of those elements, just touching on a couple of the things that Alice mentioned more specifically as well. So we're working with Southwark as well as a range of other partners to continue to improve and expand both the accessibility and the impact of the platform. There's a couple of key ones that always come up, and I can see some questions on this in the chat as well. The first one is integration with patient records, integration with GPs. So just to quickly touch on that one, we sort of conducted a pilot in the with our partners in Luton early on in this year to really understand how would that mechanism and user journey work for somebody who'd completed perhaps an opportunistic health check on the SISU Health station to then consent to have that data provided to their GP, so their GP can be aware of the data, but they can also react to that data as well. That pilot was very successful in terms of demonstrating there was a significant proportion of the users of the health station who would consent and who would like that data to be shared with the GP. And we're also now looking to introduce that as part of some of the CVD workforce programs. So more directed in that people are aware they're coming to the health station specifically for a health check as part of an NHS health check program, and then consenting to have that directed straight through to their GPs. And of course, working very closely with the GPs around what should the workflow and what should the subsequent sort of response be to receiving that data. That is still in progress. We are hoping that will be sort of released early next year, and we will sort of work with each of our partners to understand how best would that be implemented, because key to this is that every region is different. Every region has a different population. Every region has different systems, different priorities, and different sort of pressures as well. Secondly, Alice mentioned multi-language. So we have launched, I think it's about 17 languages across our European clients at the moment, and we will be bringing that into our sort of local authority and NHS proposition first half of next year as well. So you can sort of see a couple of little screenshots there as to the languages that you can now find the health check available in. What we do need to build out is making sure that we can provide those languages across all of the different personalisation and customization elements that are really needed in that sort of public health context as well. But for anyone who's interested in seeing more about that, we can sort of do little demonstrations of how that can be translated. And similarly, the SISU Health app will also be available in all of those languages for those who are not sort of native English speakers as well, so that they can then continue on their self-empowered journey to improve their health. We're continuing as well to build out all of those ecosystem elements, so continuing to build out more sort of survey capability as well as the predictive insights, so utilising that data to both provide the user even more insights, to encourage even more sort of behaviour change, lifestyle improvement, but also to start to provide more population health insights and predictions as well to all of our sort of clients across the public health and NHS space. That's all that I was going to say at this point. I think, Tom, we're going to move to a Q&A. So we'd really love to hear your questions, either for any of us on the panel, but I'll hand over to you, Tom, to sort of facilitate that if you could.
That's right, Sam. Thank you very much. Yeah, no, we had a couple in during the Alice's section. What type of work have you done to help achieve the short-term outcomes around getting your target groups to access the kiosk in the first place?
Yes, so I would say in terms of getting people to the kiosks, a lot of our sort of promotional work has been sort of targeted at the whole general population and instead of just our target groups at the moment. So we do promotion through GPs, for example, other community settings. We put it out regularly through our Southwark Council e-newsletters, and that actually does work because we do often see an uptick in people doing having their kiosk checks after those newsletters go out. I'd say in terms of targeted work for our target groups, really successful in the past has been utilising our community health ambassadors. So this is a programme in Southwark. We have more than 170 people who have signed up to be ambassadors for health within their own communities in Southwark. It was something that was born out of the COVID pandemic, and they've been integral in supporting our thinking around the programme. We've sort of done lots of engagement with them around what they want to see from the kiosks and how we can get the message out there. So that is one thing I'd say that's been particularly successful, but as the results and our recommendations show, we definitely want to be doing more in that area.
Thank you, Alice. Next question. Does the content of the kiosk cover across all vital 5 areas, mental health and alcohol too? If so, what is the mental health content?
Yes, it does. So Vital 5, for those who might not be aware of the South East London programme, is alcohol, smoking, mental health, healthy weight, and why can't I think of the last one? It'll come to me.
Hypertension.
Hypertension, blood pressure. Thank you. In the chat as well. Yes, it does cover all of those 5 things. Mental health, currently on the SISU kiosks, is a PSS4 questionnaire. One of our recommendations is that we'd like to change that to a PHQ2, just on recommendation of our clinical reference group. Other local authorities might have different perspectives on what questionnaire they think is most appropriate, but PHQ2 is the one that we would like to see on there. But as Jez said, I think you can, correct me if I'm wrong, but I think you can develop different questionnaires based on what people want to see. Yeah.
Yes, absolutely. So PSS4 is the one that we provide as standard, but we do have a range of different mental health survey requests that we're sort of working on at the moment. So I think, as Alice said, we do get different preferences as to which digital mental health tool people want to use.
Thanks, Alice. Thank you, Sam. Next question. I know, Sam, you briefly touched on this in your piece around data integration into clinical records, such as EMIS. How do you get this info back to primary care, and have you had any challenges?
Yes, I think simply it is quite a challenging space. I think anybody who has embarked on a project to integrate into sort of GPs through EMIS TPP System 1, NHS sort of systems will sort of agree. So as I mentioned, we did our pilot with Lucerne earlier in the year. That was, if you like, a manual sort of data transfer, really to prove out the context and also the willingness of users to share that GP. We've been looking at a range of options, including sort of full IM1 integrations, as well as a range of other options to ensure that we can get that sort of data back to the GP. We're expecting to do our first implementation of that early in the year, and that will be available both within an EMIS and a TPP System 1 context. But we will then have to look region by region to understand what systems are in use by the GPs and whether that integration is also suitable or whether we would need to look at alternative integrations as well. We're also progressing integrations within secondary care because we think it's really important to sort of link up also kiosks that might be used within, for example, hospitals as well as other NHS sort of trust locations. But this is quite a detailed one. Happy to sort of take that offline with anybody who'd like a bit more sort of information and detail about how that can be done.
Thank you very much, Sam. Next question. Have you considered placing kiosks in workplaces, particularly R&M groups?
Yes, I mean, this is something we've been doing for many years. So we have considerable experience as well as whole ranges of data associated with different industry, health risk, productivity impacts. And as Alice and Jez both briefly mentioned as well, we're now seeing the CVG Workforce Health Check programme. So we're seeing health checks offered across different local authorities for free in workplaces. So yeah, we have completed over 500,000 self-service health checks in workplaces across the UK. So very happy again to talk more about that with anyone who'd like more information.
Yeah,
Thanks.
and just to add to that in terms of what that looks like in Southwark. So we were successful in applying for a bid to the DHSC Workplace Health Check programme, and we are using SISU kiosks for delivery of that. And the way we're doing it is a rotational programme where kiosks will spend a set amount of time in a workplace, and we'll have a number of kiosks in the borough at any one time that sort of rotate around different workplaces. And we're very much interested in taking the learnings from that to seeing if a similar model would be appropriate for our community centres and places of worship, as I mentioned.
Thank you, Alice. Thank you, Sam. Jez, I'm going to fire this one your way if that's okay. What's the purpose of the email to use the monitor, and is it possible to include lipids and HbA1c? Tough, I know.
So we ask people for email so that in essence we can continue the relationship with them digitally. So they use the email to create an account to access the app and the online portal. And if they do repeat health checks, that becomes part of the I guess the logging in process, albeit there is a way in which they can use the app to seamlessly log in as well. In relation to capturing the lipid data, so the pilot that we are launching with Jaguar Land Rover and Solihull Council as part of the workforce pilot in January. The I guess the lipid data will be captured through a traditional mechanism, but we will be adding question sets as part of sort of capturing all of the data for the NHS Health Check to capture those numbers, which is where we're then looking to share that data onto the GP from there.
Thank you, Jez. Just being conscious of time, we might have time for one more question. Is there any evidence that kiosk users subsequently go to a GP or an A&E service to follow up on results they have from a kiosk?
Yes, so we have a couple of different data sources. So we have data specifically around people who consent for the referral of their data to a health professional. That might be a GP in the Luton pilot sense, it might be a local health and prevention centre. So we have data where we can see of those eligible who had the health risks, how many of them consented to go through, and then in discussion with those local health and wellbeing we can see what percentage then attended. We also have, as Alice mentioned, considerable sort of survey mechanisms by which we can see how many people who completed a health check then attended a GP. With the patient integration that we just talked about briefly as well, the intention would be also to have that kind of return data point to understand more specifically around who went to a GP as a result. We have quite a lot of data around who does, who doesn't, and I appreciate that's always a concern. There's always a sense in a local authority that introducing SISU might equal a sort of rush to GPs. I don't know, Alice, if you want to briefly mention the Southwark context on that, but that's simply not what we see. We see those who really need to be going to a GP do. We see those who don't now have the reassurance of self-empowered data that they don't attend a GP. But Alice, I don't know if you want to comment on the Southwark experience on that.
I mean, we only have the data from that very small survey that we did, which suggested that I think it was 8% of people follow up. Oh no, it was 8% with a general health and wellbeing service, 4% with a GP, I believe. But I'll have to go back and look at the report. So yeah, relatively small, but I will note that that is one of the questions that SISU are putting in their always on survey that will be going out to people who use the kiosks more regularly. So hopefully you'll be able to get some more accurate and representative data from that.
Thank you very much, Alice. I think we're going to close it there for questions. There is a couple that we haven't got to, but we'll respond to them in the post-webinar resources. Firstly, a big thank you to our presenters, Sam, Alice and Jez. And a big thank you to all our listeners for taking the time out of your day to join the webinar. We do hope you found it useful and insightful. As I've said, we will send the slides out and other associated resources with the recording. With that in mind, thank you very much for joining us today. Keep warm and have a great rest of the day. See you all soon.